Hi, everybody. Welcome back to episode 5 of the Broken Responder podcast. And today I have a special guest with me. I have Karen Levon, who is a psychiatric, what's that? Sorry. Labor. I'm sorry. Karen Labor, who is a psychiatric mental health nurse practitioner. She has her own practice in it's Inglewood correctly, but soon to be Greenwood Village, here in Colorado, up in the Denver metro area. And her practice is Rethink Mental Health and Wellness. Excuse me. And you contacted me kind of when I put that post out on Blue Lives Matter Colorado, and I am very excited to have you here with me today because I'm going to pick your brain if that's okay, because I have lots of questions. But without further ado, so we talked on the phone and you kind of started out as a ER nurse, correct? And then went to ICU and then for a little bit, and then I think flight nurse, yes, if I remember correctly. And then transitioned into the mental health nurse practitioner. Like, can you run us through like what got that process going for you?
Yeah. It's a lot. Yeah. So a little bit of background about me. I've been a nurse for close to 21 years now. And,
Okay.
prior to that, I was EMT. I basically started in the emergency room from the ground up. I have done housekeeping, everything short of, being a physician with that amount of student loans.
Right. So you're the jack of all trades.
Yeah, definitely worked myself up, which is, you don't forget where you come from. So it's all good things. But I spent the first half of my nursing career in the emergency department, both between Swedish. I started out there. I always have a special place in my heart. And then 11 years at Denver Health in the emergency room there.
Okay.
And I left there with my soul barely intact.
Right. I can imagine.
And, went to the ICU for a short time, and then my ultimate goal was to be a flight nurse. So
Okay.
I worked for Air Life Denver for several years. And while I was at Air Life, that's when I, started going back to school and eventually decided on mental health, which I think I told you this recently, if you would have asked me as an ER nurse if I was ever going to go into psych, I would have been like, no, that's for crazy people.
Yeah,
like,
you've lost your mind.
Like, you're crazy. Why would I do that? No way. Because I liked the blood and the gore and the action and just that constant movement. You put me in the middle of a mass casualty and I was at my calmest. Like, I loved that.
Right.
However, I often refer to trauma, and a lot of people refer to this. It's like death by 1,000 paper cuts. And then that last paper cut, it's like when you use hand sanitizer, you don't know what's there. And then it's like, oh, that hurts. And that last little cut in that lumen of that vessel just makes you bleed.
Yeah.
And, I had never really thought about PTSD, really. I mean, that was for other people. I grew up
not me.
You suck it up, Sally. Don't complain. Like,
put your big girl panties on.
I heard somebody say once, very early in my career, that there is a stack of resumes on this desk, and if you can't hack it, somebody else will.
Mm-hmm.
So I was like, okay, so stuff it, keep going.
Yep.
That's how you do it. And
Yep.
You don't complain. Like they would pass out, which now I look back at and I think it's funny, but these hurt feelings applications, like go hurt feelings application is actually hilarious if you ever find them online. But
right.
You couldn't talk about things, or you would get made fun of.
Right.
And we all have so many things that we've seen or those calls. And, something I said to you the other day is we all have that, like the mom scream, specific ones that you never forget, the pitch, the sound, what you were wearing, that just lives rent free in our head.
Yes.
And I didn't know how to charge it rent,
Right. Yeah.
to do with it. And
right.
Early, before I was a nurse, I was working in the emergency room at Swedish, and I think I was a ward clerk at that time. And I had sought EAP, and I can't remember. I truly can't remember which thing it was for. But when we discussed the other day, if I were to guess, it was these two young kids. I want to say that they were twins, but gosh, this was close to 30 years ago. Also,
Right.
and they were with their babysitter and playing hide and seek, and these kids had gotten into one of those the top chest freezers,
Oh,
an old one without the safety latch, and I didn't know there was a safety latch on the inside. And babysitter couldn't find them, called police to report it missing, and EMS and police, like, I think it was the EMS that found them, opened up this chest freezer, and they were huddled together. And I'll never forget, I had walked away from the desk where I was supposed to be doing my job, but totally wasn't. And I was watching, like, there was a window outside the room, and the paramedic, I will never ever forget, he came out of the room after giving report, and just, here's this big burly guy, and I'm all of 18 or 19 years old, just breaking down, hands in his face, sobbing. And that did something to me. It was like, and I just, to this day, I have this picture painted in my head of these little kids, like, and I'll talk a little bit more about how this relates to lessons I've learned that have been career saving for me. But I wrote this story or this movie in my mind of what were they going through. I bet they were afraid. Like, were they holding each other because they were cold, or was it hot? And started going through and writing this story that was just paving this pathway for trauma. And so I went and saw an EAP counselor.
sure.
And EAP is something that, unless they are trauma first responder EAP therapists, I just, as responders, we just don't sync with those people.
The EAP stuff, like I've done that when like my mom died from alcoholism and she was an ER nurse there at the end. But the like EAP, you talk to them and it's like you start explaining, and like when you see their eyes like in shock, you're like,
Yeah.
oh great, like
Yeah.
this isn't gonna work.
Yeah. And I, assuming it was this call that I went for, and again, I truly can't remember, but whatever I was telling her about, because, there was probably a culmination of different things. I just remember this girl, she was young, had blonde hair, and I remember, like, she was really pretty. And she just sat there, and her eyes were just kind of red and started welling up. Like, she wasn't bawling in front of me, but I could tell that she was trying not to cry, and she was a little sniffly, and she just kind of sat forward, and she's like, "Can you excuse me?" I'm like, "Sure." And she was wiping her face with Kleenex, and she didn't come back. And
Oh wow.
I was like,
Does this mean my appointment's
are we
canceled?
over? Is it the time? Like, is this, I'd never been to, counseling in this fashion before. I was like, is this normal? Is this how it works? And then I was like, wait a minute. I, I did that. Like, holy cow. I look back now and I'm like, I feel like I should have gotten like a plaque or something for that.
Right.
But, she quit. Like, she didn't
Holy
come
cow.
back. And I was like, you read about that now and people are like, oh, that doesn't happen. That doesn't happen. I'm like, oh, it does. And to this day, I'm like, man, I wish I could remember what I said that like pushed her over the edge. But she was also very young, as was I, and was, all I know, she was an intern or something. But
Yeah.
so,
Probably a little naive too about
yeah,
everything.
you go in for counseling, and whether it's voluntarily or mandated, and that's a whole nother issue. But you're afraid that you're going to traumatize that person, and so we hold back because, and that's a perfect example. Like, here I was, I'm like, I need help, I don't know how to process this, and I'm getting in trouble at work, and I'm distracted, and I'm just kind of a mess. But I don't want to tell you why,
Hmm.
because as soon as you tell them what you do, like, oh, I work in the ER, or I'm a firefighter or law enforcement, or well, nobody says law enforcement, they'll say like I'm a trash collector or something like that.
Yes.
But they'll be like, oh man, you've seen so much. And it's just like, it's that equivalent nauseum of during COVID with all those stupid heroes work here signs. And you're just
Right.
like, I don't even, we're done. Like, we're done before we even started. So fast forward into my nursing career, at Denver Health was, man, I loved my job there. Loved taking care of the people there. Like the honorier, the better. I didn't care. I was usually actually pretty impressed. The more honorary somebody could be, whatever.
Right.
There was, and this is just, I'll just give you one example of many, but there, I was in charge one day. So I was a charge nurse in the ER there for quite a while. And we got a call on the biophone, which is the phone that the paramedics will call in on, that they were coming to the ER emergent with a, and I quote, partially decomposed peri arrest. So someone who's about to go into cardiac arrest,
Right.
also partially decomposed. And I remember whoever the doc was that answered the phone hung it up really slowly and looked at me, and both of us were like, what? So they come in with this patient, and I have never, ever, even to this day, seen something so horrific. And this woman was, gosh, maybe if I was going to guess, 40-ish pounds, because skin and bones might weigh about that much.
Holy
And
crap.
so I remember like sucking the oxygen out of the room, and I went and I grabbed what's called the Broslow cart. It's a cart for pediatrics, so we can do weight-based medications and IVs and things like that are smaller. And this woman was, she had been given something called levamisole, which is like crocodile. I'm not sure.
Oh, okay. Yep. Yep.
Where we're mixing that with all kinds, cutting heroin and meth and all kinds of things with it. And essentially what this had done, and I didn't know the story at the time, I'll tell you that in a minute, but she was still alive, but barely. And her tibia, like the tops of her legs and even on the side of her legs, looked like charred matchsticks. Like I could see into, they were sticking out like a stick that was like broken and kind of jagged at the end, and it was black. And she had like holes in her face. I could see through her face and her teeth, and they were black. It's like something had, like a flesh-eating bacteria.
Wow.
It was black. And it was like this all over her body, and she was alive, but she had no fat in her at all. And where that is important to the story is when you don't have fat, like with somebody with a severe eating disorder, you lose the fat pads in your eyes, and it's difficult to blink. And one of the things in the hospital that has always been a sore spot for me is that we would talk about our patients and not to them, like we're doing this and calling out assessments and traumas and things. And I remember squatting down next to her, didn't know the story still at this time, and looking at her. And I very much believe that people have a right to know if they're not going to live.
Sure.
Because otherwise it's this fear looming of, am I going to live? Am I not? Do I need to make peace? And it's just not fair. And I remember telling her that I was there, and I told her my name, and I said, you're safe. You're here. I'm so sorry that whatever happened to you, that this happened, and you're not going to live through this.
That's terrible.
And I might have said, you're probably not going to live through this. I can't remember, but I remember, and she had one little tear come down her face, and I'm like, I don't even know where that water came from inside of her.
Right.
And I just remember telling her, like, you are not going to be alone. You will not be alone. We are here. I am here. And I'll never forget her face, like just sunken in and seeing through that. And everybody in the room, and I didn't find out until many years later, the that everybody struggled with trauma significantly. Well, not everybody, but several. So the story behind this girl is, in what I had learned or been told then, was that her boyfriend, quote unquote, she had been laying on a mattress, on an empty, there was nothing there but a mattress, and he had been selling her essentially, and had Yankee candles everywhere because she smelled like a dead body. She was decomposing.
Oh,
And when he couldn't handle the smell anymore, and assuming maybe he wasn't making any money anymore,
time to get rid of her.
to get her out. Like, and to this day, whenever I see, well, Yankee candles are overpriced, but
Yes, they are.
I don't want Yankee candles, because I just think about that. And I was
Like, it associates with that deal because
yeah,
of the
like
story.
I'll get the Target brand. Like, I'm gonna,
Sure.
as long as it doesn't say Yankee Candle on it. But the other things that were happening that day was, so all of our computer systems had gone down. The biophone went down right after that. The phones went down. Anytime we would get traumas, they're called trauma activations, I would call up to the OR and be like, hey, this is what we're, so they would get the OR ready and whatnot. And when the phones went down, like those, the office phones that have all the little red buttons on them,
Mm-hmm.
all of them all over the ER were lit up. Well, we were getting multiple trauma activations. It's a Tuesday in Denver, so shootings,
Right.
stabbings, whatever. And everything was at a standstill because all of us were like just frozen in time with what is happening with this girl. And it was just, man, I remember like ambulances coming in and I'm like, oh my gosh, like, okay, this guy's bleeding all over the floor. I guess go in there. I don't even know what's wrong with him. And trying to manage all of that was not fun. So we get this girl up to the medical ICU. She did die either the next day or 2 days later, and come to find out, like, her family she'd been a missing person out of Texas.
Oh, man.
And what was really awesome, though, and I can say this now, is the family, they were able to get there and then
To be able to spend time with her.
Yeah.
Good.
Yeah. So this is all happening. We get her up to the OR, and this is just so typical, right? Like, you see the most horrific thing you've ever seen, and then you're like, okay, now we've got, drunk guy in the hallway bed who's just drank all the hand sanitizer, and, somebody's fighting in the waiting room, or you just keep going.
There's no room to really like process anything. It's just you keep going.
Yeah, same thing. Like, when I was a flight nurse, the radio goes off, you got to run another call, just keep going.
Right.
And about 2 days later, that's that classic phrase, when trauma starts to set in, a couple days later, I remember I was at the grocery store, and I hadn't been sleeping well, and I was just really tearful, and I thought, oh, okay, maybe I'm just PMSy or whatever, and warned my husband. And I'm at the grocery store, and I was standing in front of the refrigerator with all the gallon of milk in it, and it was overwhelming, and it's like I short-circuited, and I was like, do I want 1% and skim milk, and do I need organic, or do I the Safeway brand, or just completely short-circuited? And I'm bawling because that decision was too much for me. And everybody's like, oh, everybody stay out of that aisle, there's a crazy lady.
Right.
And I had to leave the grocery store. Then I get home, and we were living in Evergreen at the time, had a wood burning stove, and it was snowing, and I went out to the porch to get some wood for the stove, and then I'm crying again because I couldn't decide which piece of wood. And, like, it's gonna burn, it didn't matter, but
Right.
it was mission critical for me at that point. And I just kept picturing like all the red lights and people screaming about where we're going to put these patients, and I was just stuck in this loop. And thank goodness my husband, who he's a police officer, he was paramedic many years ago when we met, but he said to me, he's like, maybe you should go talk to somebody. And I'm like, for what?
Right.
It's just hormones. And he's like, like, you're not okay.
Yeah.
And that is where I had my first experience with a true first responder therapist, and
Sure.
oh my gosh, that woman, like, shout out to Robineski, man. Like, she was a game changer for me. I had no idea that that's what it could look like. And, she taught me so much, just learning to tell that story. And the more I told it over and over and over again, it didn't stick as much. And one of the ways that I refer to trauma and is if you think of road rash, right? Road rash is really painful.
Hmm.
And the hard side of Velcro. And if you've got this road rash right here and the Velcro is just like rubbing on it and,
Yes.
scratching it and making it bleed, but you can't find the Velcro and what's irritating it, but it's just bleeding. And the more I told that story, and even if it was the same thing over and over again, I would learn things each time, but that Velcro slowly started to fall off and then it started to heal. And that's just one of small but big lesson that I learned to just keep telling those stories. And so that wasn't like my first big with what trauma could feel like. Fast forward to, and I'll just tell you, I'll try and keep it as a little brief, but it was another morning in the ER and I was in charge, and there was an OIS. And this girl had been trying to run over DPD, and long story short, they ended up shooting her. Well, I didn't really know any of the background stuff for years, but I remember standing outside of R1, which is one of the trauma rooms where we put this girl, and she had, she from a distance you would have thought that she was a boy, short hair, was dressed, collared like khaki,
Sure.
dressed like a guy.
Yep.
And there was a police officer standing next to me, and it was kind of back in the corner, and kind of he quivering lip, and I didn't really think much of it. Well, she'd been shot in the chest multiple times, so we're doing what's called clamshelling her chest, which was when we opened like her
Hmm.
entire chest. And as soon as they exposed her chest, and this officer saw that she had breasts, he like broke down right then and there and just started bawling. And I was hearing him say like, it should have been me. It should have been me, not knowing what he meant. Apparently he had been late or something and it should have been him on scene.
Oh
And it was
no.
one of his friends or something that actually like ended up getting hit by the car and ended up shooting. And that was a whole nother situation. But um, as soon as he saw that, he just started sobbing, and he ran out and ran into this bathroom in the hallway. And I just like instinctively like ran after him and followed him until I thought, oh wait, this doesn't look right. I'm like following him into the bathroom.
Right.
But so I waited outside for him, and he was just in the bathroom, just wailing and sobbing. And after he came out, we just I hugged him and we just sat and we talked for a while. And in that moment, I was like, man, who takes care of you? Who takes care of all of you guys? Like in the ER, yeah, we do a terrible job taking care of each other, but at least we have each other.
Right.
You can go in the lounge and, cluck away and bitch and whatever you need to do, but who takes care of you guys? And that really started me on a path of we need to do better. And, my husband, being at the police department, they have a great wellness unit at Denver Police, and they were hosting Jim Grossman.
Yep. I
And
like Colonel Grossman.
yeah, and why am I forgetting his name right now? Shoot, I feel horrible. From Caliber Press.
Oh yeah, Dave Grossman. Yep.
No, not yeah. I'll think of it. It was Dave Grossman came with Jim Glennon. Thank you.
Oh, okay.
Yeah. So I went to that seminar, and oh my gosh, it just lit this passion in me. And then I was able to go see, man, what is it? Kevin Gilmartin. I had to turn around and look at my book, Kevin Gilmartin. And I just
Okay.
started learning so much. And when I read Kevin Gilmartin's book, it's that emotional survival for law enforcement and their families. It's so applied to me. I was like, I understand this. Like, I know I'm not in that law enforcement role, but holy cow. And man, from there, it was just, I just developed this passion, still not knowing that I was ever going to go into psych.
Sure.
Um, this was close to, gosh, this was 5 or 6 years before I even left Denver Health. Um, but I mean, it's just the watching the trauma. And then, one of the paramedics at Denver Health who had been there for decades, that was that quote unquote strong one,
Mm-hmm.
that was always there for everybody else. She was the one that everybody called. And I got a call in just past midnight from a friend of mine who was one of the physicians in the ER to let me know that she had shot herself and killed herself. And that was awful.
Yeah.
And, Debbie, everybody knows Debbie. My husband was a paramedic. They were partners. Like, everybody knew her. And it was just like somebody just ripped my insides out. And I wasn't even as close. I look at this, and this is something you'll hear commonly. Well, like, I wasn't really close to them. I don't know why it's affecting me. Because we are caregivers.
Sure.
All of us, law enforcement, anybody, like, we are the people that respond to help people when they're hurting. And how could we not have seen our own?
Right. And I think that was one of the questions I wanted to ask you about. I think like when we talked on the phone is just like you said, it's always the ones that, we go to the funeral and they were reliable. They were dependable. They were the go-to person for everything. But what can we do to like identify things with those folks, or like, is there a best practice, or what can we do to help each other out?
I don't know if there's a best practice, just because it's so individual. Something that I share with people is when I remember sitting in the ambulance after a call, and I was struggling with that call. And,
Yeah.
the culture at Air Life was just awesome. So I was very blessed to have that culture, but it made me think about, other EMS cultures where it's not really, two dudes aren't going to hug it out after a call. Like,
Yeah,
maybe, well,
right.
I don't know. But I've taught at paramedic schools, teaching like some mental health resiliency lectures. And I'm like, sometimes it's okay. Even if you're okay, if it was a tough call, be the one to initiate. Just be like, man, that call was really messed up, man. Like, I don't know if I'm okay after that. Like, here's how I'm feeling. Like, even if you're fine, like, make it up. I don't care,
Right.
like, because you may be sitting with that person who doesn't know how to explain how they're feeling. Comes from the old school that we grew up in with, like, you stuff it and keep going,
That was my problem completely.
Yeah. It's like, pack it and stack it in that corner, and just, you'll go to choir practice later and blow it off.
And for those who don't know what choir practice is, that's basically when we all get together and drink about the day and discuss things, and doesn't really do us much good either, but it feels good at that moment.
It does feel good in the moment. Yeah. And it's amazing though when people do that. And, even, clients I see now will tell me like, oh my gosh, like, I did that. And it opened up the floodgates for someone who I thought was a total asshole, like, never talked to anybody, just
Yeah.
quiet, and thought it was grumpy all the time. But they were actually really, really struggling. And just making it safe for other people to, that phrase, like, it's okay to not be okay, like, it's so cliche and it annoys me. But rather than saying it, like, live it.
Right. I think like normalizing check-ins with,
Yeah.
the folks that we work with on a daily basis. And even if it's after like a crappy call, like you said, like, hey, how are you doing? Like, I think for me, the toughest one, and it never had anything to do with, it was critical, but My toughest call was like an 8-year-old girl who had passed away at home, and it literally looked like the parents had beat the living snot out of this girl, bruises, everything. Uh, and my responsibility at that time was to guard the body in her bedroom. And all I could do was sit in this poor girl's room and cry, and I'm sorry, there's nothing we could have done or we should have done better to protect you. And thankfully, through the investigation, we learned that, this poor little girl, like, had some rare autoimmune disease. Her parents were doing everything they could, children's, but like those are the ones that just absolutely stick with you.
I am so glad that you just worded that the way you worded it. Because when I said earlier how I had started to write this movie in my mind,
Mm-hmm.
that's a perfect segue.
Yep.
um, there, it's easier to kind of just tell this as a story with the concept and how the concept comes out of it. And this is a lesson that I learned early, well, late, actually, very late in my career. I had gone to this secondary trauma and resiliency 3-day training that I actually ended up teaching for several years after that. But this lesson that I learned, let me just explain it as a story. So, we flew out, my partner and I got a call, do a gunshot wound to the head, middle of the night. And so we're flying out there and I'm like, I'm stoked. I'm like, yeah, we're going to get procedures. This is going to be great. I love calls like this. It's nothing like, oh, somebody's shot. I was like, yes.
Right. Yeah.
And so we get there, the helicopter lands in the front yard and, it's out on the Eastern Plains. And I remember we get out of the helicopter and, there's all these lights on the house and I see detectives, I'm assuming detectives are just people in the garage with some guy sitting in a chair in handcuffs. I was like, okay. Well, as we're walking up to the door, I see all these liquor bottles and toys. And like, there was like this little pink right
Oh
on thing,
no.
right on. And I was like, oh, this might kind of suck a little bit. And walked into the house, turned down the hallway, and it was like a Stephen King, like there was this bloody handprint wiped all down the hallway. And so, but still in my mind, I'm like, okay, this is going to be cool. Well, like
Right.
I immediately went to that. So this woman had been shot point blank in the face with a 40 cal snake shot.
Oh,
And by her boyfriend. And so she was groaning and I there was a bunch of firefighters there and a lot of them, I don't know if they're volunteer paid, but very young. And this, I didn't know at
mm-hmm.
the time, they'd never seen anything like this. And so she's on the bed and I'm, her head's between my knees so I can intubate her. I just remember telling the firefighter, I'm like, oh, I need you to hold her head. Like part of it is kind of
Right.
not there. And wrapped it, like he's like, how do I do it? How do I do it? I'm like, just wrap it in the sheets and just hold it still for me. So as I intubate her, she ended up doing what's called herniating with, your brain. When the pressure, you just herniate out your brainstem and it's a non-survivable injury. So, we worked her and like, it was kind of futile, but we did it anyway, right? Like that's
Sure.
what you do. You do
Yep.
everything to make sure that, and before you call a code or before, it's just good practice. Like you ask everybody, like, does anybody else have any ideas? Is everybody okay with this? And everybody was shell shocked and they're like, yeah, okay. So
Right.
she dies, we call the medical director and to get the pronouncement. And I've got her blood all over my flight suit. And I just remember looking up to my left and asking one of the firefighters, I'm like, are there kids here? He's like, yeah, they're downstairs. And I was like, oh, okay. Is anybody going to tell him? And they were like, no.
Oh.
And, working at a teaching hospital, residents, God bless them. I love my residents, but they just are not good at death notifications. They use
There's like no humanity to it. Yeah.
forever sleep or whatever stupid term, So I'm like, okay, well, I'll go down and talk to them. I'm very comfortable with death notifications. So I went downstairs in the basement and the girl's dad was down there just drunk as a skunk holding this. There was like this little yippy, like puntable sized dog, and I'm an animal lover, but I was like, oh my gosh. And so I just remember all these dogs barking and he's drunk and he's like, yeah, they were real close to their mom. And I'm like, what? So there's a victim's advocate with these kids and they were, elementary, middle school age. And as I was going in there, I saw these kids, it's middle of the night in September, and they have brand new clothes on. And I started immediately writing this story, similar to how you're, when you're sitting with that girl.
Mm-hmm.
More. And I remember thinking, oh, man, I remember when I was little, when we would go school shopping, it was like an event and it was so exciting. And I bet they did that with their mom. And I wonder if they planned that outfit, laid it out for their first day of school. And they were so excited for their friends to see their new clothes and their new shoes. And now they're not going to get to do that anymore. And oh my gosh, they're going to miss all this stuff with their mom and their life and this and this and this. And I started writing this horrible story in my mind. And as I sat down to talk to these kids, the victim's advocate literally pieced out. She's like, oh, good, you're here, and leaves. So I'm sitting here like with kids trying to comfort them as their mom's blood's on my flight suit. But as I'm hugging these kids, I remembered this lesson that I had learned many years ago. And it was like, I don't know how this is going to turn out. And I'm purposely speaking with my hands because, when we have that trauma, we're holding it really tight. We won't know it. But as I'm thinking of these kids, I'm like, wait a minute. I don't know if the victim's advocate gave them those clothes. Maybe they don't own clothes. And I don't know what this is going to look like for them. Maybe they're both going to grow up and be crackheads. And I don't know, but maybe one will be a neurosurgeon. One will be a victim's right advocate for children, or, people can do profound things with trauma. And I don't know. And I chose in that moment and throughout many other calls and things that I was involved in my career, it's okay to tell yourself that story of, what an amazing thing. Like you look at some of these neurosurgeons, like, how did they get there? Where would we be without them? Like, we don't
right.
I think about this is not a political, but like Ben Carson had a hard childhood. And
he had like everything stacked against him.
Neurosurgeon, politics aside, like look at what he's done because of what he grew out of. And so this is all going through my head and I'm like, okay, this is a story I need to tell myself. Well, we get out to the helicopter and the generator's broken, so we can't fly. So the ambulance has to come and pick us up. And I'm sitting in the front, with the EMT who's so sweet. And she was like, man, like, this is rough. Like, what happened? And I'm like, and then I just started telling her, like, I don't know what's going to happen with these kids. And here's what I'm choosing to believe, because it's possible.
Yeah.
It is possible. Even if they do end up as, residents of East or West Colfax, crackheads, those people can still transform and change people's lives. And that makes me okay with it, because also, in addition to that, maybe those kids had a horrible life. Maybe they were abused. Maybe they were pistol whipped. Maybe.
Sure.
And I'm going to go that way because I don't want to think of this white picket fence family where they were having dinner where, abusive boyfriend, and
yeah,
that's horrible to think about. And it is okay to tell yourself these stories of maybe this is what their life was like.
Yeah.
My very first intubation was a 4-year-old who had the snot beat out of her by mom's boyfriend. And when I put the blade in her mouth to intubate her, her whole face lifted up. And, she ended up living, however, on, when we were flying her over to Children's, I remember thinking, I'm okay if this little girl dies. There were several CPS cases open. I'm like, she never has to go back to that. And, everybody looks at things differently. Like I am very, very strong in my Christian faith. And I remember thinking, like little kids, they go straight to the arms of the Lord. And what an awesome thing for her. She never has to go back to that.
Yeah.
And I mean, do you see where I'm kind of going
Yeah,
with this?
no,
Like,
I get it. Like
any story, and it could be true, and
yeah,
that's okay.
yeah. Um, and so in like talking about things that you learned late in your career, and it took me forever to learn this. Cause I used to think, that every alcoholic, they're like some kind of piece of shit, same thing with drug addicts, they're just shitty people, you're stupid, you're dumb. And it wasn't until late in my career, well, not late in my career, but it took several years for me to realize that they're not, like what, so like, for example, some of them, trying to suppress some type of trauma that they went through, or the fact that, they get high to avoid, thinking about that or to disassociate themselves. So for me, it was one of those things in my career where, transporting them to jail. And I would just sit there, and it was kind of amazing to see the change instead of, the normal attitude in the back of the cop car where they hate you and they're berating you. And I would just go, what happened? Like, what happened to you? Did you get into, you get in the oxy deal where they were giving you a bunch of pills and then they just cut you off one day and now you're doing heroin and fentanyl? And it was so crazy because the stories that they would tell you in that car ride to the jail were absolutely, some of them astonishing, disgusting, and just unbelievable. And then I would follow it up with, if you, do you have kids? And they'd be like, yeah, I got kids. And be like, what would you do if your kids were in this moment right now and you were the parent watching them go through this? And by the time we would walk into jail, just alligator tears. And, we get down there and they're like, what did you do to them? And I'm like, we just had a conversation on the car ride down there. And the thing I learned later was having those conversations and treating suspects, arrestees like actual people. Man, the results that I got and the changes later after that, like it was unbelievable to finally realize that and get out of that old mentality that I had of they're just worthless people. And they're absolutely not. Like everybody's got a story. It's just whether or not you choose to actually ask them and hear it.
Yeah, 100%. Somebody said to me recently, we were talking about just a call that this person was struggling with, and they said, I don't want to know anybody's name. I don't want to know anything about them. I just compartmentalize it. I'm like, okay, like I get that. We all have
Mm-hmm.
this box, that eventually, the
Is
flex
going
is
to
still
explode.
like it's going to start to dissolve. But it's okay to give people a name. And I say that cautiously, so with an asterisk, because like this gal, with the levamisole, for instance, I didn't, I don't remember or, know her name at the time, but I remember her face. And, when you compartmentalize, you internalize it, and then it's like compartmentalize, traumatize,
Right.
versus I thought about her. And one of the things I learned, as I was telling that story and processing why it was so hard for me, and just like the horror that somebody could do that to another person. And
Yeah.
I'm like that. And that's just like the tip of the iceberg, truly, with like some of the things that when you're first on scene for a call, like this is the tip of the iceberg for probably some people. But I just remember thinking like, she was safe. She got to see her family. She would, even if she lived through that, she would have never been the same, you
Yeah.
know. Like that would have involved multiple amputations, and let alone the trauma.
Oh, yeah.
And she's free,
Yeah.
and she got to see her family, and she got to be in a warm bed, and be around people that loved her. Is it the ending that she would have wanted for herself or her family? No.
Right.
But
But at least she had some kind of comfort there at the end.
right. And and on top of that, like, what did her family do with that? Like, what what could have come from that?
Yeah.
And what did, like, I know for me, that was massive post-traumatic growth for me. Massive.
Yeah.
It took me a long time to be able to tell that story without like sobbing all the way through it or at some point. But it has changed me and for the better in the long run. And I wouldn't be doing what I'm doing today if it hadn't started with things like that.
Yeah.
You know?
So, if you don't mind, I am going to pick your brain
Yeah, let's
on
do it. Yeah.
some other stuff.
Yeah.
So, there's like, let's start off with the first thing we talked about, I think, the other day, and that's the, like, I don't know, we said probably 30+% now of undiagnosed ADHD in first responders.
Oh, I bet
Like,
it's way higher.
yeah,
Way higher. Yeah. There's no true statistic,
right.
but yeah.
But yeah, so that's something that's prevalent in first responders is undiagnosed ADHD, which would probably explain now why I don't have my career and I am just all over the place some days. Uh,
Oh, go ahead.
no, I was just going to say that's one of the things, like, after you and I talked and you kind of sent me that little quiz, I was like, holy crap, I do have like
How
ADHD.
dare
I
you?
probably, I do need to talk to a doctor about that. Um, so I guess in some of this stuff, like most of the stuff that all of our first responders see, and I had to look it up because I know some of the terminology keeps changing, but I would say most likely there's probably like three types of trauma that first responders go through, and that's including nurses. I throw nurses in that same category. Is the acute, the complex, and the delayed onset.
Mhm.
Is that accurate, or what
Um,
would you say the most common kind of PTSD is for our first responders?
um, that's an interesting question. I've never thought about a common
I mean, because
anything
so
like that.
for me, and I know like Denver's just as crazy as it was down here in Pueblo, and sometimes I mean it's almost a little more crazier because we're so much more compact than a city like
Pueblo's like
Denver.
the Denver. You guys are like the DG of Southern Colorado. Um, yeah.
Right. Uh, but I mean, I know. So there was parts of my career where I think, what is it? The acute is like that
Right.
situation
Couple
at that
days
time.
later. Yep.
Yeah. So
Mhm.
for me, that was like both of my officer involved shootings. But also at the same time, I had like that delayed onset with those. Like, you understand the gravity of the situation, but it doesn't like really come back uh like to bite you until a couple days later. And then for sometimes it's months later
Yeah.
when it comes in. What, I guess, for me, I think the best practice that I would like to see, and I don't know if it would ever be possible through legislation or anything else, but I seriously think we need like actual trauma therapists in departments, and not just, big departments. I mean, smaller departments. Because for me, going through my stuff, the worst thing was, workman's comp wouldn't give me anything to help with, my sleep issues because, I
That's
literally,
what I'm a doctor.
yeah,
There's another thing that I'll pick on in a second.
as soon as I closed my eyes, I vividly relive it over and over to the point I didn't want to sleep. So now I'm days without sleep trying to deal with that stuff. And the worst part of it was it took 2.5 months for me to even get in to see a
Yeah.
psychiatrist.
Yeah.
And I think that's like the major disconnect is I think maybe we could have curbed some of my stuff, but it's just terrible. And you're at the whim of workman's comp.
Yeah. I couldn't agree with you like 1,000 times more if I wanted to. With there's a couple things that play here. We'll come back to the ADHD in a second, but one of the things, and I did not get to this. I totally forgot actually. Speaking of ADHD, the reason. So when I went back to school, I started as a just acute care nurse practitioner, thinking, okay, well, I'm in emergency medicine. I'll just stay the course. until when I really thought about it, with the struggles I had with trauma, you know, I went to see primary care and I love my primary care. Let me be like, she is awesome. But, you know, and this, it started actually long before her with a different primary care, but they don't understand how we think, first of all. They don't think about the demands of our job and like don't give us, some medication because this algorithm says like, oh, here's your rubber stamp diagnosis. Over here, this is what you're supposed to take because the book says this is first line. That's we're not a diagnosis, we're not an algorithm,
Sure.
and our cognitive processing speed is everything for us to stay safe and do our jobs. And when you're struggling with trauma, some of the first that's the first thing to go is your cognitive processing speed. And we start to have this deficit in oxytocin. That's why we can't connect with people. We isolate. Our sex drive goes away because you're already struggling with isolating with people, and then that something's wrong with me, I'm broken, like, and then you go down that dark hole to where, well, why am I even here? And when I went to my primary care, and they're like, oh, well, here, just take this SSRI, and I was like, okay, I didn't know any better at the time.
Oh yeah.
80 pounds later, and just feeling flat, and the only emotion that I could feel was anger, because at least that was motivating,
Hmm.
anger or nothing. And it's like there has to be a better way. And when you talk about not being able to get in to see anybody, that's the other issue. It's like you wait and wait and wait and wait. You either wait for workman's comp, or you're like, okay, I guess I'll just use my insurance and go see my doctor because I don't know what else is wrong.
Right.
Well, when I changed to mental health, to psychiatry, I did it knowing that this is what I was going to do. I'm like, I want to work in a state hospital. I want to care for my own people.
Sure.
And that involves like, we're here if something happens. Now, psychiatry and psychotherapy are different. Let me just delineate, because when you talk about the department therapist, there are places like that do exist, like Broward Psychological, Code 4, first responder trauma counselors, Nicoletti, Flater, like they do respond to critical incidences. They have emergency numbers for responders to call 24/7. And in turn, which is so wonderful with how this has worked out with being able to develop these relationships. If there's somebody who is in crisis, they're not sleeping, they cannot regulate, they will call me or one of the other providers here and be like, hey, like, sorry, it's a Saturday evening at 8 o'clock, but this guy's not okay. I'm like, you got it, no problem. Like, let me jump on a call with them.
Sure.
Developing the scaffolding approach for people, like where they have these amazing trauma trained therapists that are trained for first responders. And then, in Rethink, at least, I hire current or former first responders, veterans, or ER nurses in the family of such. Like, you have to be in the family because you have to get it, and you have to
Sure.
be, understand what they're going through. And not
Yeah.
half the time I'm jealous of the calls that these people go on. So, but it's also about how you prescribe to people. Like, most people with SSRIs, and SSRIs are like Zoloft, Prozac, things like this.
Oh, those
Most
are
people,
miserable.
they're awful. Now there's a time and place for them. It's it's a very small time and place, and for me as a prescriber, everybody practices a little bit differently, but um, it's it's not about putting a band-aid on a bullet hole,
Sure.
and meeting people where they're at, like understanding what their role is. Like, oh, okay, so if you are a banker, right? Like, you're gonna have stress, but not the same stress. Like, you have to be able to. Are you gonna be able to shoot straight, like be in a
Right.
foot chase and shoot straight, or is your mind gonna be blah blah blah, and you're gonna be 60 pounds overweight, so you can't be in the foot chase,
Hmm.
And there's so many things to treat trauma and acute responses, like with there's acute, complex, and
Yeah,
chronic
all of
trauma.
them.
um, but they essentially affect this. They're the same brain structures that they can affect. And it's about how you intervene and how quickly to prevent PTSD.
Yeah.
And even when somebody already has it, you can turn those symptoms around, and it's life changing.
So, and that's another thing. So looking at your website, definitely piqued my interest on the ketamine therapy. And can you talk about ketamine therapy? Like, what does, like, so I know some people are going to be like, oh, they're handing out psychedelic doses. Yeah. How does ketamine work into PTSD and helping with those symptoms?
Oh, ketamine is a unicorn. It is awesome. Ketamine does a lot of things. So people think, they'll think of like Matthew Perry, like ketamine killed him. And, a lot of people will go to, oh, well, Elijah McClain, they killed him, blah, blah, blah. And I'm not going to,
Yeah, we'll just avoid that.
Like we're not even going to go into that because but people, when they think of ketamine, especially in law enforcement, people do think about that. And then, other people think, well, Matthew Perry. I'm like, nope, ketamine is a very safe medication. It does not do anything to your respiratory drive. It is very safe. That's why, we used it in the helicopter if we were intubating, because we wanted them to keep breathing until we had to paralyze them to put the breathing tube in. It works great for pain, anesthesia, all kinds of things. But in the mental health and world, ketamine is the best sobriety aid of all time. So
for like alcoholics, does it work for like drug users, or is it?
It all kind of depends a little bit, but yes, but especially, I mean, most of what we treat with ketamine from a substance use perspective, or not most, a good portion is alcohol. But yes, it will help with other addictions as well. Hugely
Okay.
with other addictions. There's over 60 years of research on ketamine in the mental health arena. Nobody's ever really, I was actually just speaking to a friend of mine about this not too long ago, who is very big in, the ketamine world. Nobody's ever really pinpointed what it is about ketamine that can interrupt that alcohol withdrawal cascade. You have to
Okay.
hit them at the right time. But if somebody comes in and they're like severely withdrawing and sweating and hypertensive, not the time to give them ketamine.
Right. Yeah.
Normally I drink, a couple of pints, or, I go through a handle every 2 days, a couple bottles of wine. And, I've had a few shooters this morning and they're just that's a great time to hit them with ketamine. And, I had a very good friend of mine who, I was telling you about her when we talked the other day, who was drinking like a couple handles, bottles of wine, shooters, like a very
Yeah.
functional alcoholic. And she has been sober for just over 3 years now since her second treatment. Like ketamine just takes away that drive. And I'll explain the mechanics of how it works in a second. But anti-suicide, man, ketamine is also incredible for that. You can put someone on a hold and like that does no good except shame them.
Right.
Time and place, I guess. But for trauma, depression, anxiety, OCD, pain, like even mood disorders, like bipolar spectrum mood disorders, it works amazing. So how it works, and I have to use my Office Space analogy.
Sure. No, it's okay.
Because you got to smile when you talk
Right.
about it. So, in the beginning of Office Space, Michael Bolton's in traffic. And if you picture a mental health journey as being in all that traffic, and it's 400 lanes wide in 1980s smog LA traffic, no air
Sure.
conditioning, nothing. And you go and see EAP, okay? And your lane starts moving a little bit. And then you're like, okay, well, I'm still not sleeping, having nightmares, panic. Go see your primary. They put you on a med that actually makes you worse, but you move a little bit forward and your whole journey is stuck in these lanes of traffic and you cannot see a way out. And what ketamine does is it does something called increasing neuroplasticity, or growing new pathways in your brain. So it's like growing an exit right to your car, and only your car, where you get off on this brand new fresh pavement, just perfect. And you get to drive on a new road. So if you picture like these, neurons in your brain, it literally will grow new connections.
Oh, that's
And,
cool.
I went through ketamine therapy before I went into this field for trauma. Had a lifetime of cumulative trauma that
Right.
I didn't know I was holding. And the dams were starting to break. The tape on those boxes was starting to fall apart. And I also refer to ketamine as the most amazing housekeeper you could ever imagine, that gets everything so clean, but you didn't invite them.
Yeah.
And, we have those cobwebs with the poisonous spiders or the snakes, like the things you're like, I'm going to leave that cobra alone. We have an understanding.
Right.
This ketamine just knows what to do in your brain. It doesn't ask your permission, and it will just go in and sweep those corners out. And let me give you an example, like a real world example. When I was going through ketamine, I thought I was going for just job related trauma, right? Because that makes sense. It's easy to
Sure.
blame it on. And, you know, sorry, let me back up just a little bit with the dosing. And, we do intramuscular ketamine, and your body does develop a tolerance. So we start at a smaller dose, and with each time you go up on higher doses. And I'll explain why that's important in just a minute. So my third ketamine treatment, they had gone up on my dose, and you just literally lay back in a recliner. You've got headphones with a playlist, an eye mask, and a blanket, and you just kind of chill and go on this journey. Well, I remember when I started it, I remember each session and started with like dark, angry colors like black, red, dark green, and it was just like, it just felt angry, and really sharp angles. Like I was like the speck in the universe, but it was nothing was flowing, it was just like really,
Yeah, just all over. Yeah.
yeah. And so, but with each session, the angles got softer, the colors started to get lighter. But my third session, I just remember feeling my face was really cold and wet, and I was just sobbing. And this nurse practitioner, her name was Jen. Jen, if you're out there, you're still my angel to this day. She came in and she's like, "Why are you crying?" And there was some childhood trauma that we had an agreement was to stay in that corner of the brain and never to be thought about again. And I was able, for the first time in 40 years, 40 something, to speak the name of this person and talk about what had happened. And that was it being swept out. And the tears on my face felt like I was being washed clean from that pain. And it just got swept out that day. And when you think about that new road you're driving on, I could look back from my car, beautiful new car, air conditioning, new road, and see all that smog and all that trauma and be like, oh yeah, like that did happen. And that, okay. Oh, look at that other new car next to it. Like that's a pretty color. Didn't overtake me anymore. I wasn't like, that car right there that's so damaged, that's who I am. No,
Yeah.
it's just another piece of crap car that I got to leave behind.
Nice.
And it formed those new connections. And through, when I went through the whole induction series, and with ketamine, it's usually 6 to 8 sessions over, like 2 or 3 times a week. By the time I got to the last session, all of those angles and colors changed. And I remember in my 6th session, I'd gotten up to 200 milligrams of ketamine, which is, it's a little different for everybody, but I had to get to that point. To where I was like in this field of flowing grass and flowers and daisies, and it was pastel greens and whites, and I just felt free.
That is
And
awesome.
it changed my life. Absolutely changed my life.
That is cool. So is it, I guess, so it's not necessarily micro dosing. Is it more of a little bit bigger dose that actually takes you necessarily on like somebody would consider a psychedelic ride or journey?
Yeah, so ketamine, and this is a common
Misconception about it.
ketamine is not a psychedelic; it's a
Oh,
dissociative.
okay.
Psychedelics are like psilocybin, ibogaine,
Oh
DMT,
yeah, it is one of those
where
dissociative.
it's you're
Yeah.
off on whatever journey you're on, LSD, things like that. What ketamine does is you disassociate. And so when I talk about the dosing, like their first visit might be 60 or 80 milligrams, right? So we would do one injection in their arm, take their vital signs, one injection, wait about 10-15 minutes. As long as their vitals are within these appropriate limits, then you give them the second dose. And it starts to kind of warm up your brain. Like when a steam engine is just starting.
Okay.
It's got to start until you can kind of get a flow.
Yep.
And everybody dissociates at different doses. The first time I did it, I was like, this is freaking awesome. Like, I was like, this is fun. I know why people are doing this now. Like,
Right.
what have I missed out on all these years? I was just having a good time.
Yeah.
But the second dose, when I started to disassociate, was scary. And I remember thinking that I was a patient in R4, which is one of the trauma rooms at Denver Health. And I was in the 4-point leather restraints and dozens of people were trying to like hurt me. And
Right.
I couldn't defend myself, which was so indicative of all the trauma that I'd been storing. And I remember trying to fight and I couldn't. And my husband was there with me at the time and he could tell I would just start sighing and starting to get scared. And you can do this with ketamine. Like, you're okay. This is
okay.
You're not there.
You're safe. Yeah.
Okay, I'm here with you. You're safe. And just hearing that, I was like, okay, I'm safe. And it doesn't matter what your intention is when you're going in with ketamine. Like, I'm going to work on this.
It just does whatever it needs to do.
And it just knows where it's going to go clean.
Okay.
And it just does it.
Nice.
And with each dose, there's this thing called ego dissolution. You think like Sigmund Freud and the ego.
Mm-hmm.
The logical part of your brain is where trauma takes up residence. The non-logical, the reactive, I call it the 12-year-old boy brain, where it's just like, just
right.
speak without thinking. That's where trauma starts, that fight or flight, but it lives in that logical part of your brain. And with ketamine, you have to get to a high enough dose where it's called ego dissolution, where you just drop it. And for me, I had to get to 200 milligrams. That's when I was free.
Okay.
And that's where the road had been graded, the gravel had been laid, the potholes filled in, but the final top layer and sealant didn't get laid until I got to that final dose.
That is so awesome. And that's one of those things, like, after like talking to you on the phone and looking at the research, I think that's something still for my PTSD that I am definitely going to look into doing and probably come up and see you guys for.
There's never a wrong time to do it.
Right. Is there, I think ketamine. So here's the other, I guess, question I have is, I know a lot of our first responders are going to be scared about the ketamine therapy.
Sure.
Because, departments have drug policies and everything else and, worried about that. I guess, is there something in that medically where it gets looked at differently, or I guess more that's like a department policy and procedure stuff, but I think maybe something that needs to get changed because it's a recognized therapy.
Well, so there's a couple answers to that. I know a lot of departments are finally changing that, any medication you have to be on, if you didn't disclose it, you'd catch an IA case or
right.
things like that. But ketamine is, like, in this environment, it's a medication and you are medically supervised by a provider. So myself or the other nurse practitioners here. So it's like if you were on duty and you fell and broke your wrist and it's something that they need to like put in place in the ER, they're going to give you ketamine.
Oh, okay.
It's a great medicine and you disassociate. So you don't care that they're cranking on your bones. You're just like, you're pretty,
right.
You don't care.
Right.
So, and the thing with ketamine is when you get those shots of ketamine, so those 2 shots, from the time of that second shot, the dissociative part of ketamine is done anywhere 20 to maybe 45 minutes. Sometimes maybe an hour, depending on how your liver metabolizes that medication.
Okay.
The dissociative effects of ketamine are only during that time. The metabolites of ketamine, it's called HHNK for short, because it's a very long word. Those are present from, about an hour, 1 to 2 hours after you get that injection, anywhere from 3 weeks up to several months. Those metabolites have 0 absolutely zero dissociative, mind altering, delayed cognition effects, nothing like that. That is
Perfect.
where the antidepressant and the anti-inflammatory effects come from. And trauma, depression, you pick a mental health disorder, is all about neuroinflammation and gut
Okay.
inflammation. That's where, like with trauma, little side note, like I always ask people, like, hey, do you have chronic pain? Not duty belt pain, everybody's got that, but
Right.
do you have like this chronic pain that you can explain? Do you have IBS? And people are like, how did you know? And I'm like, because that's the trauma trifecta.
Right.
You know, and ketamine, it's incredible. So how it helps with that. But that HHNK metabolite, if you're going to pick it up in urine, that's like a CBI level drug test. And I don't even know if it would be picked up then. That's for somebody who's like, doing their special K raving ketamine all the
Okay.
time, every day.
Yeah.
So it's very,
Okay.
very safe. Yeah.
Is there, so outside of, and I guess each individual person, like is there different therapies that work for different people, or is there, like, you have talk therapy, you have EMDR, eye movement desensitization, yeah,
Yeah.
uh, and reprogramming. So there's those. Is there a specific therapy that, like, if you have a first responder that comes in, uh, is it, what, I guess, what is the therapy that you recommend? Is it always straight to ketamine, or is it
No.
dependent
Um,
upon that person?
well, it depends on the person. And, as far as therapy, um, like I still, this baffles my mind, but according to the State Board of Nursing, with the whole semester of psychotherapy that nurse practitioners get, they say we can do therapy. We're not therapists.
Sure.
Like I just tell people, I'm like, my quote unquote therapy is just a lot of poor life choices and lived experience.
Right.
But we work very closely with that patient's permission with whoever their therapist is.
Oh,
So,
okay. So it's like a double-headed tag team
yeah, and that's what
approach.
I'm always talking about, that scaffolding approach. Like people, when they are just constantly feeling like they're falling, and nobody's going to pick them up, they don't know how to get out of that pit. Like we're scaffolding around you. Like their therapist may call me like 8 o'clock on a Saturday, like this guy's in crisis. And then I meet with them, then I call that therapist and we work together and we work for that person.
Awesome.
I tell that person, whoever is sitting with me, I'm like, listen, you don't work, you don't work for me. I work for you.
Right.
Like we give you options and explain, here's what's going on in your brain and your body. Here's some ways to treat it. So when you ask about certain therapies, it just depends on where their trauma's from, the complexity of it, what else is going on with them. It just really depends. And
Okay.
tying this in with ADHD, so if like here's the symptoms of PTSD and here's the symptoms of ADHD, slightly different parts of the brain, but like
They
a
just
lot of times
mirror
it
each
has no
other, kind
difference
of. Yeah.
because of the area of the prefrontal cortex that it affects. The symptoms often look the same, and now if you picture, here's my hand here, if here's ADHD and it's not treated, you've got depression, anxiety, imposter syndrome, social anxiety, substance use is massive when you're not treating ADHD. Pick your, pick your symptom.
Right.
So, with people who come into the office or just anybody, like it could be your partner on shift, if they're struggling with substance use, chances are there's a very high possibility that they may have some undiagnosed ADHD
Okay.
because your brain, it's the same thing with trauma, your brain will remember where it got dopamine last.
Okay.
And with ADHD, this part of our brain it develops differently. So we have less of that dopamine and norepinephrine, and we're always in search of that rush.
That next
That's why
craving.
in mass casualties or super intense things, we are like, why is everybody freaking out? I'm so calm.
Right.
Because it stimulates your brain and your brain is able to think clearly and calm down. That's why nicotine is so commonly used, because it's a stimulant and it
Okay.
calms your brain. Alcohol, not so much a stimulant, but you're just trying to quiet your brain.
Yeah.
And when you treat ADHD in someone who is struggling with addiction, it decreases addiction by 60%. You know,
Holy cow.
it's, it's when people are in rehab, for instance, you know, I have such strong feelings about these rehabs who are like, no controlled substances. I'm like, they are there because they need a stimulant that
Yes.
will help them. So you can't ask somebody to sit through hours of therapy when they're thinking about squirrels,
Right.
you know,
Yes. You're just all over the place.
and then they feel like a failure. They're, why can't I get better? Why can't I do this? Well, because your brain is wanting those receptors to be absorbed with the dopamine that they need. So,
That
you
is
know,
okay.
yeah.
Wow. Um, so I guess one of the things that I also was trying to think about and understand is, and I don't know if there's a study or a correlation, but I think a lot of the trauma that first responders see and experience, it's kind of like almost two pronged because one, we start becoming like jerks at work, getting in trouble, doing all that other stuff. But I think it also uh, like almost damages kind of your moral compass because you'll see folks cheating on their spouses. Oh, well, my spouse doesn't love me. They don't spend any time with me. What are you doing though to fix that? Because I struggled with that because, I would come home and you just want to sit on the couch. You want to watch TV. You don't want to go anywhere. You don't want to deal with anything because everything's stupid or it's dumb or I don't want to see people. What are those? And I guess also, that's what gets a bunch of people in trouble and the high divorce rate. Like, is there something we can do better to recognize that stuff or certain things we should look for to help those folks to curb that before it turns into something bigger?
Um, that's that's a multifaceted question because that's a symptom
Right.
versus a habit.
Okay.
Um, so that's where Kevin Gilmartin's book was so the biggest thing I took from reading his book was he talked about like going fishing every Friday. His fishing gear was in his car. Even if he didn't get it out, it was in his car. He'd go to the spot or, just sit there. Even if he didn't take his fishing gear out, he chose to do something to disconnect from work, disconnect from the stress that could start to fill his cup.
Okay.
And, somebody worded it so perfectly once. People are always like, oh, what fills your cup? What fills your bucket? And I'm like, well, you can keep filling it all you want, but when there's 40 straws from other people in your bucket, and this relates back to like Debbie before she killed herself. Everybody had their straws in her cup, so she couldn't keep it full. So, we over identify with our roles so much. Like, yeah, like I am a flight nurse, or I'm an ER nurse, or I'm a cop, or I'm a firefighter.
It's like our whole personality.
That's that's a role. What happens when that role? What happens if you get fired?
Yeah.
Who are you? So and it is so foreign to think about that. Like, well, I mean, my life will be over. Well, I mean, that's
Right.
choice, but I mean, it doesn't have to be. It's just paused while you figure out who your identity is. And by
Yeah.
doing that, like just once a week, I don't care if it's start with 15 minutes. Like, you know, I'm gonna sit and color. Like people like, oh great, here's the coloring book craze. But especially for someone with ADHD, if you told me to sit and read a book, I'd be like, okay, first of all, like I'm gonna think about 400 other things by the time I'm at the bottom of that page, and it's just gonna stress me out because my to-do list is gonna be front and center.
And
Like do things that help you disconnect and lower your work.
once I discovered coloring and to go into that, like, oh man, like I would buy like the most complex adult coloring books I could
Yeah.
find,
Mm-hmm.
in between pencils and
Yeah.
markers. And it is just like, I guess the best way, it's like a mind numbing. Like I am the only, my focus is just on how cool I'm going to make this picture.
And people will say, oh, self-care, you got to eat right and go to the gym. And I mean, that's great if you are, a rec center that just hands out a wellness list to everybody who comes in the door that's carbon copy. But for some of us, it's like, okay, well, if I've had a really tough day, like I'm going to call my sister on the way home and just like,
Sure.
blah. Or I'm going to, people have their routines, like, people in the medical field. And well, I'm sure as responders as well, you get home and you take everything off and you just shower, and people will think like, okay, that's how I like wash my day away. Well, that didn't ever work for me. I had to like get things out and be tactile and talk and do stuff.
Yeah.
I like weightlifting, but I don't wake up every morning and be like, oh, I love this, I'm gonna go
Yeah.
work out.
We go be a
No,
power
punish
lifter.
me, I'm gonna go do it. But so everybody's self-care list looks different.
Okay.
And so like you want to look at like what will sustain me in my emotional life, what will sustain me intellectually, what will sustain me spiritually, what will sustain me in my relationship life, professional. And it's different for everybody. What are some goals? Like maybe I want to learn to play the guitar. Okay, let me put that as a goal, and make your own self-care list. That's
That's
why I think
cool.
there's not a carbon copy for anybody, but when you do it that way and you write it down, you can start to tick away at it and remind yourself of, okay, here's what I need to do if I'm feeling disconnected.
That is okay. That is some actual great advice. Like, I never kind of thought of it that way. I think for me, like one of the things that like, so I teach officer survival. Well, I taught it at our in-house academy, but I still teach it at our local community college. It's like trying to find those habits and hobbies, to keep, to kind of keep yourself grounded, to, fill some of your spare time. And I think some of the worst things we do as first responders is, we get together, we drink, and then all we do is bitch and talk about work. Like we don't ever take that break and
Mm-hmm.
disassociate ourselves from it because like like you said, it's our whole like being and lifestyle. Like I'm a cop or I'm a firefighter,
Mm-hmm.
I'm an
Yeah.
EMT or like you
Yeah.
just it's so crazy how like that whole deal like it consumes your life.
Well, and with ADHD, I want to spend a few minutes talking about that, but our social batteries get drained really quickly.
Mm-hmm.
And it doesn't help when you're always around the same people that sometimes are stuck in the same feedback loop, and we have to recharge somehow.
Yeah.
And people will say, oh, you're the life of the party, you're so fun to be around, like you do, but then you're like, leave me alone. Like I tell people, like I love taking care of people and I love people, but I don't always want to be around them,
Right.
you know and
Yes.
so with ADHD, I'm going to just explain this because it's really important for people who are listening. There was a study, I think it was in 1997, I believe. There's not very many studies on people who have ADHD as adults, in responders, especially. They did a couple small studies on in for the Army, I believe, and the ones in responders, they did some very small studies on firefighters. And this was in the late 90s, right? So that's
Sure.
when ADHD was still a discipline problem,
Yeah.
for the kids in school. 20% of firefighters and veterans or active duty military veterans, I think at that time, had ADHD. 20%. That was then.
Yeah.
Okay.
Yeah.
I will tell you, man, if I could guess, I mean, I don't know, hopefully I won't get put in like psychiatry center hell for this. I don't know, but over half
I would, yeah, definitely.
responders.
If it's only that in the like late 90s, I mean,
Mm-hmm.
yeah, it's got to be higher than it, at least 50%.
Oh, I would like 50, 60%.
Well, and
So,
I
oh,
wonder if it's something to do with also like that, like a generational shift. Maybe it's some of the different circumstances or whatever. I don't know because
um,
I don't. Is ADHD more of a genetic trait that gets passed?
that's debatable. So
Okay,
people say yes, there's a genetic trait, and now depends on what research you're looking at. Now, some people are like, yeah, kind of maybe it's debunked, maybe it's not, but I want to picture it this way. So we definitely choose our roles and our jobs. We are drawn to this job. Like
Yeah.
nobody who is afraid of blood says, I'm going to be a trauma surgeon. They're like,
Right.
no way, I'm going to go work with the library, because we get that rush. Now, if with ADHD, here's how the ADHD brain works. Um, I think I told you my little Ferrari analogy the other day. Most of us who have ADHD are a combination of inattentive, hyperactive. People think hyperactive is a little kid a little boy especially, who couldn't sit still in the classroom, always in trouble, running around, probably did have
Right.
ADHD.
Yeah.
But in women, it presents much differently, and in a lot of men too. So, how the ADHD, it's a neurodevelopmental issue. It's how our brains develop. So, is it genetics? Possibly. I don't know. I mean, the jury's out, truly.
Sure. Sure.
But it's how your brain develops. Now, with the ADHD brain, the reason we thrive in chaos and do so great as responders and even in the military is because you give us 100 things at the same time, or video games or something where there's a lot of action. We are right as rain,
Okay.
because our brain goes from being a Ferrari in a school zone with 10 people inside the Ferrari, and they all have their own radio station, and you're singing the chorus of every song and you
Right.
love every song and it feels normal, but you're missing the school children and the cop you just drove by going 100 miles an hour and everybody else, because it's all right in front of you and it's going. So, oh, what were you saying?
No, I'm listening. I'm just thinking of a question right now
Okay.
that I want to talk about after that.
Okay. So that's an ADHD brain. Now, if you give someone with ADHD a stimulant, people think like you're snorting a line of coke, you're taking meth, you're stimulating your brain. What it does, you change the wording of it. It stimulates your prefrontal cortex right here
Hmm.
to actually turn on and function appropriately. So when you turn that on, now you've stimulated it. You go from that Ferrari going 100 miles an hour doing donuts to a Honda Civic going 65 on the freeway, one song on the radio. You're enjoying it. You hear all the words, checking your mirrors, you got your seatbelt on, and you see everything around you. And that's where, like, people, with ADHD can drink coffee as a stimulant and fall asleep. They use nicotine because it quiets their brain. Same with energy drinks. Now, if someone's stimulant dose is too high, like if I take my stimulant and drink a whole bunch of coffee, for instance, then I turn into the old lady in the HOV lane driving a Buick,
Stuck in the
going
left.
25, and I will fall asleep. People without ADHD take a stimulant and they're like ready to go. Like their
Right.
house was painted in 2 hours flat
Yes.
because their prefrontal cortex is already stimulated and turned on.
Okay.
So it's so important when, like, especially with kids, if you don't treat ADHD, they say by the time of 12, and this is just from a statistic. I was diagnosed as an adult and my life could have been so much different.
Right.
But my life is amazing, so I wouldn't have changed it. But if you don't treat it by the age of 12, it increases the risk of developing some sort of addiction, not just substance use, by 40%. And so
Wow.
parents
Okay.
think my kids were diagnosed with ADHD, and I thought, I don't want my kids to be on a stimulant. They're going to be tweakers. I don't want them to grow up and, be a
Sure.
tweaker.
Right.
But by treating it, it lessens that.
Okay.
So it
Okay.
has the opposite effect.
So the question I was going to ask with that is, or similar to it, is, so I keep getting told like the PTSD brain. Basically, and I don't know, maybe if that's my undiagnosed ADHD going on inside, but I have to set up myself like a daily task list,
Yeah.
because my like short-term memory, is like finding like Dory sometimes, like it is just there and gone. But then also sometimes it, right, it affects like I wouldn't necessarily say like the long-term memory. But like there are coworkers that I worked a couple years with that, like right now, like if I were Like I can tell you, like describe them, but I can't remember a name. Like it just, I think for me right now, that's the most frustrating thing dealing with the trauma is like, is there really a PTSD brain or is it kind of like the
Absolutely.
undiagnosed ADHD?
It could be both,
Okay.
first of all. In fact, the VA did a study treating PTSD with methylphenidates. Methylphenidates are a type of amphetamine. That's what like Ritalin and Concerta, and it's a class of stimulants.
Okay.
Um, because where it works in the brain with PTSD, it will turn that, it'll help increase that memory and boost that executive functioning as well, increasing that norepinephrine and that dopamine. Um, with PTSD, so PTSD, this is, more of an integrative medicine way to explain it, but it is a neurodegenerative autoimmune process in your brain. So, um, what happens is, we have this center in our brain called the hippocampus, and that's where memories live. So, with your amygdala, that fight or flight, the smells, the sounds, the song on the radio, the emotions, everything that happens in that moment, your hippocampus says, okay, I'm going to take these and we're going to form memories out of it. So when you pass by that intersection or you hear a song on the radio, you're going to have this visceral response.
So like that
And
flashback response kind
yeah,
of.
yeah,
Okay.
yeah. And so what happens though over time is that hippocampus starts to get smaller. And if you think of like an autoimmune, your body attacking something, like it's not working, all hands on deck, we have to get rid of it. It starts to get smaller. And so you walk into, your kitchen and you're like, I came in here specifically for something and I forgot. And people say, oh, it's age related. First of all, age related is not an okay excuse for anything.
Right.
It dismisses a
Yes.
lot of symptoms
Yes,
and
it
people ask for
does.
help. So, but it's that memory center. And the good news is like that can be treated,
Okay.
and I mean, for some people, completely turned around. You can recover from that. That's where, with the VA study, treating with methylphenidates, just like ADHD, you start to remember things and you have that functioning and you start to get that reward.
Okay.
So there's a lot of different ways to treat it too. Like TMS is a fantastic thing for treating. I mean, it's not approved for PTSD, but so it's approved for, it works for depression and anxiety, which are a result of PTSD. And
Okay.
it's what TMS is, it sends magnetic impulses similar to like what an MRI does
Sure.
into the brain. It's a medication free way. And you just literally will sit in this chair for 3 minutes or, up to 19 minutes, depending on what your treatment protocol is. And it delivers these magnetic impulses into these brain structures to essentially, like for lack of an better way to explain it, rewires them similar to ketamine. So
Okay.
like ketamine and TMS together is like healing on steroids,
Okay.
and you start to get that memory back and that
Okay.
functioning and not feel so overwhelmed and suddenly the tsunami hits when you're least expecting it.
Okay. So here, I guess, and here's another thing. I just sparked my memory thinking about that stuff. What do you think? And I know I'm gonna mispronounce this procedure. It's the stellate.
Stellate ganglion block.
Yes.
Yes.
What is that like a good therapy, or how does that help
Yes.
folks?
Stellate ganglion blocks are awesome. The downside is that insurance doesn't pay for them. So if you're doing it on an outpatient basis, like some of the treatment centers for responders will do it, which is
Okay.
amazing. But on an outpatient basis, at least here in Colorado, you're going to pay roughly somewhere between 3 and 5 grand, give or
Just to
take,
get the one.
just to
Okay.
get it done. So what is stellate ganglion block? So if you on the base of our necks here, basically, so we have stellate means star. So
Okay.
we have this collection of nerves here called the stellate ganglion. And with trauma, when you're in that constant hypervigilant state, you are just dumping norepinephrine. And what happens is it releases something called extra nerve growth factor. And if you think of, like the ivy that grows on the side of the brick, only it's your eyes, your window to the world. And these extra nerves are growing to where you're stuck in this panic loop. Or you think
Okay.
that, or depression, insomnia, nightmares, you name it, because it's kept you in, it's grown over it. So what a stellate ganglion block is they inject the stellate ganglion with anesthetic, so numbing medications, and it resets it. Like some people have relief within like 10 minutes.
Oh, wow.
Now, some people, just speaking to different providers who do it, some will do both sides, some will do one. If you need to have it again, they'll come back later, they'll do the other. But it's incredible. But only 80% of us have a stellate ganglion. So,
okay. Yeah. So it's not all.
Yeah. So, I mean, there is that risk that you're going to spend a lot of money and
not have anything done.
But there's also an 80% chance that you will.
Okay. So, and I guess in that, so the person, when they're doing that, they're kind of in that constant fight or flight, just kind of rolling around in there. It's so it works on that, or do they have to almost kind of, I guess, take them back to that event to get it spiked? Or is it just kind of...
I have to do nothing.
That's cool.
In an OR setting, a sterile setting, it's just like ketamine.
Okay.
The house comes in and doesn't ask your permission, just get out of their way, and they start sweeping. With the stellate ganglion, by injecting it with the anesthetic and the medication, it just immediately, if that loop is just going, it puts the brakes on it and stops it, and it resets. It's like turning your computer on and off again.
Okay. So, that is awesome.
It is incredible.
I think, let me see here. Let me go through and make sure. Is there, I guess, so let's say you're just a regular person or supervisor or anything. What are some of the initial signs or symptoms that you should start to look at folks and be like, damn, they probably need some help? Is there any like kind of sign or symptoms that you would say immediately, like recognizable that this person is starting to go down a road that they need help on?
If let's say you're that easygoing guy that we're like, things, it's water off a duck's back, and all of a sudden you're a rooster.
Right.
You want to peck everybody. Like, are you getting irritable and like pissed off about things, having this reaction that doesn't really fit the circumstances? That's usually a later sign.
Sure.
Are you usually 15 minutes late for work, and now you're getting here right on time, and now it's a few minutes late? You're a little bit later every day. You're calling in sick more. You're not getting your reports turned in. You're not doing complete reports before you turn them in. Little mistakes, just like I said, that trauma can be a death by 1,000 paper cuts on the lumen of a vessel that has several layers. Each little cut can cause just slight changes in personality. Are they looking a little haggard? Have they maybe like, gosh, what's with the beard, man? Like, if somebody who's like super high and tight haircut, and all of a sudden they've got some facial hair, and they're like, I just don't give a shit.
Right. Those are those kind of initial cues.
I can't have this, like, according to new policy, like, you can't tell me, and are they that social butterfly that now is like, nah, I'm just, it's easier to isolate.
Yeah.
And I want to be kind of in the shadows, don't notice me. Little changes like that are the beginning of slicing all the way through that lumen of a vessel. Does that make sense?
Yeah, no, it perfectly does.
And for those people, who are going to be like, I'm fine. Because like 30% of responders don't feel comfortable talking to their command staff.
Yeah.
And that's just a reported statistic. And it's not the command staff's fault necessarily. Like it's a culture, but it's also politics and, all of that. So that's where I say sometimes, like, it's okay for you, even if you were fine, be like, man, like the stuff that has been going through my mind lately, like you can guess.
Right.
And humanize it for them. Like, okay, I'm not the only one. Maybe I can trust this person to talk to them.
Okay.
Talk to peer support. Peer support has a layer of a legal protection. They cannot turn you in.
Yep.
To anybody unless you're a danger to yourself, others, things like that.
Yeah. Okay. Wow, that is a lot. So is there, I guess, other than like there's, I guess one of the things that I've learned, and it was rough because I'm now finding about all these resources that are
Mhm.
out there that
Yeah.
I guess sometimes maybe outside of the Denver metro area, like I had no clue that they were actually there to help, or the fact that, like inpatient therapy, like that was never a deal for me at all. Like, I think one of the things we
You're given
struggle
a psych
with,
ward and you yellow
yeah,
down and
yeah. Oh, well,
find that's everything that you
I,
know.
I got the turtle suit there for a day because
Yeah. Like
they
here are the
set me
props.
for a mental health evaluation.
Yeah.
Um, it man, there's just so many things out there that like
Yeah.
we don't know about. But I think also, I think the toughest part for me and my struggle was
Mhm.
not seeing that way out for the
Yeah.
longest time. And when people talk about it, it's like that tunnel that you're in, you're floating barely on your tippy toes, and
Yep. Yep.
it is just rough. I don't know. I guess I would probably wrap this up because here soon I've got a golfing tee time with a buddy here. I apologize.
That's
Um,
okay.
what I guess in the end, what would you tell somebody, or if you had to look back at yourself, in those years when you started to struggle, like what advice would you give yourself back then if you could go back?
To not settle. I went to a provider who just said, take this. And it turned me into a person that I was just a medicated version of me. I wanted to be me. I wanted to know what happiness was. I wanted to connect with my kids and my husband and my family. Don't, if you reach out and first of all, you're told it's going to be months, there are resources out there. Like, I think I told you on my webpage on the resources tab, there's a ton. But like, if you go to, Code for Counseling or Brower or Nicoletti, like on all these first responder pages, there are resources. You
Okay.
know, is it like, oh gosh, if you text badge, I'm not gonna. It's even on my own. There're just so many things like you can text. You don't even have to talk to a person, face to face. If that's where you need to start out, and if someone's like, hey, take this medication, and you're not comfortable with that, find someone where you connect that you are in charge of your care.
And I think that's one of the things like people don't realize, like talking to therapists is, if you don't feel comfortable with that therapist, like
Yeah.
find a different one.
Yeah.
Cause
Don't wait 4 or 5 sessions to be like, well, maybe no. But the
yeah,
first couple sessions, if it's not okay, we're
you
gonna
can
dig into
tell if
the topic.
you're not clicking with that therapist.
Yeah.
Yes. Wow.
Let me say just one quick thing
Yes, ma'am.
with um and I know we don't have time much more time to really talk about this, but with psychiatry, with first responder psychiatry, finding a provider that, like, look on their website, like, do they talk about, like, do they use the right language? Like, people will use, trauma therapists, but are they trauma informed? Are they involved with departments? Does it say anything about first responders, veterans, um, somebody that will relate to you,
Yeah.
and find someone who's going to spend time looking. Like, if you were to come into me, I'd be like, let's check your labs. If you're suicidal, if your HDL is low, like if you came back and your HDL cholesterol was 35, there's a sevenfold increased risk of suicidal ideation with that. Like, there's
Okay.
so much under the surface physically that can be fixed to where a lot of people don't need to be on medications,
Yeah. And I think
like,
one of the things I saw on your website, you guys actually do like the genetic testing,
yeah,
or
yeah,
the markers, whatever, to see if someone needs medications, which meds would be more appropriate than doing like the pill roulette and going
yeah.
through all the highs and lows.
Which leads to treatment resistance. It makes it harder for you to treat.
Yeah.
It doesn't have to be that way. There are so many incredible, for people who are listening who are having really high anxiety and don't want to take a medicine, there's this stuff called Calm Aid. And
Oh,
in
yeah.
Europe, it's known as Selexin. And it's a first line prescription in Europe for generalized anxiety disorders. And what it is, it's a proprietary, double top secret proprietary blend of lavender oil in a capsule form. It's 80 milligrams. You can take it once a day, take it twice a day, but typically it's once a day. It hits the same receptors in your brain that Ativan hit, and this horrible antidepressant that people still use called Paxil. And after about a week of taking it, it really saturates those GABA receptors. And like the title Calm Aid is perfect for it. It just helps you feel calm and you're not like overthinking. There's so many natural things that actually work. That's not just burning sage.
Sure.
You can do that if you want to, but
Right.
just find someone who will listen to you.
Okay.
Like if this is the route you want to go, find someone who will go that route with you.
Awesome. Well, thank you for your time, Karen. I greatly appreciate. Maybe we might have to set up a second one and go through all the other stuff again. And I will definitely have to sit down and kind of do some more research on some of the different therapies and stuff and pick your brain. But thank you for your time. I greatly appreciate it.
Yeah. If people is okay if I.
Yeah, go for it. Yeah, throw your business out there.
If people want to look for, and not even just about my business, but like for resources, tons of resources on our page. It's www.rethinkcare.org. And if you go to the resources tab, there's a ton there. And there are links to first responder counseling agencies as well.
Awesome.
We also have a list compiled here at the office of first responder counselors that, people can reach out to us, to the phone number to the office on text, and they don't have to be a patient for us to send those to them.
Awesome. Well, thank you. You're doing amazing, and I appreciate it. And we'll have to look at doing another one.
Awesome.
Awesome. Thank you, Karen.
Thank you so much for having me. Have a great day.
You're welcome. You too. Bye.
Bye.